Today, let us discuss about amoxicillin. Amoxicillins are used to treat certain infections such as pneumonia, bronchitis, infection of ear, nose, throat, urinary tract, and skin. It is used in combination with other antibiotics. For example, in case of Helicobacter pylori induced peptic ulcers, it is used in combination in order to eradicate the bacteria. The amoxicillin is the class of penicillin-like antibiotics. Amoxicillin generally contains beta-lactam ring and which is fused to thiazolidine ring. It is the basic structure 6-amino-penicillinic acid. It is attached to a side acyl group chain. These are extended spectrum penicillins. These antibiotics have beta-lactam ring which is responsible for bactericidal activity. These amoxicillins are acid stable. Because of this reason, they can be given orally. Chemical name is 6-D beta amino parahydroxyphenyl acetamido penicillinic acid. Amoxicillin comes as capsule, tablet, chewable tablet and as a suspension. Amoxicillins belong to aminopenicillin group. They have extended spectrum of activity. Mechanism of action. Beta-lactam antibiotics bind to penicillin binding protein which is present on the bacterial cell wall. They inhibit the transpeptidase which inhibit the cross-linking of the peptidoglycan. Therefore, it results in the cell wall deficient bacteria undergoes lysis and thereby it produces bactericidal effect. Peptidoglycans are the proteins which are responsible for the bacterial cell wall synthesis. By inhibiting the peptidoglycans, this results in the rupture of the bacterial cell, finally lead to the death of the bacteria. Dosage forms and strength. Oral solution. It is available in suspension form 125 mg per 5 ml, 200 mg per 5 ml, 250 mg per 5 ml, 400 mg per 5 ml. Capsule form 250 mg, 500 mg. Tablet form 500 mg and 875 mg. For tablet chewable 125 mg, 250 mg. Amoxicillin dosing and uses. For bacterial infection, amoxicillin dose is 250 initial dose and dose can be increased up to 500 mg for every 8 hours or 500 mg to 875 mg for every 12 hours. Children and infants older than 3 months of age, dose is calculated based upon the body weight. The usual dose is 20 to 50 mg per kg of body weight. It is given for 3 times a day or 25 to 45 mg per kg body weight per day. It is given 2 times a day. For treatment of gonorrhea, adults and children weighing 40 kg, 3 grams taken as a single dose. In children 2 years and less than 2 years, dose is based upon the body weight. The usual dose is 50 mg of body weight per day combined with 25 mg per kg of probenicide and taken as a single dose. For treatment of H. pylori infection, especially in the peptic ulcer condition, dual therapy is preferred. 1000 mg of amoxicillin, 30 mg of lansoprazole, each given 3 times a day for 14 days. In case of triple therapy, 1000 mg of amoxicillin, 500 mg of clarithromycin and 30 mg of lansoprazole, all given 2 times a day for 14 days. In case of ear, nose and throat infections, if the infection is mild, then dose is 50 mg prescribed orally given 2 times a day or 250 mg prescribed orally 3 times a day for 10 to 14 days. In case of severe infections, 875 mg prescribed orally for 2 times or 500 mg prescribed orally for 3 times for 10 to 14 days. In case of genitourinary tract infections, for mild to moderate infections, dose is 500 mg prescribed orally 2 times or 250 mg prescribed orally 3 times a day. Severe infection, 875 mg prescribed orally 2 times a day or 500 mg prescribed orally 3 times a day. Spectrum of action, it is effective against E. coli, mirabilis and or E. fasciitis. In case of skin and skin structure infections, for mild condition 500 mg prescribed orally 2 times a day or 250 mg prescribed orally 3 times a day. Severe infection, 875 mg orally 2 times or 500 mg prescribed orally 3 times a day. Lower respiratory tract infection, 875 mg prescribed orally 2 times a day or 500 mg prescribed orally 3 times a day for 10 to 14 days. For anthrax, post-exposure inhalation prophylaxis, 500 mg prescribed orally 3 times a day. In case of infective endocarditis, 2 grams prescribed orally 30 to 60 minutes before procedure as a prophylaxis. In case of Lyme's disease, 500 mg prescribed orally 3 times a day for 3 to 4 weeks or 50 mg per kg per day 3 times in divided doses. Maximum is 500 mg dose. Chlamydia infection in pregnant women, first trimester, 500 mg prescribed orally 3 times a day for 7 days. For kidney impairment patient, dose is adjusted accordingly by creatinine clearance calculation. In case of mild condition, if the creatinine clearance is more than 30 ml per minute, no dose adjustment is required. If in case of severe condition, creatinine clearance is 10 to 30 ml per minute, 250 to 5, initial dose is 250, maximum dose is 500 mg given 2 times a day depending on the severity of the infection, should not exceed 875 mg. In case of severe patients on hemodialysis, dose is 250 to initial dose or 500 mg maximum dose. It is given as a single dose. It should be given at the beginning and end of the dialysis. Side effects. General side effects include nausea, vomiting, diarrhea, rash, vaginal yeast infections. Severe side effects. In some cases, hypersensitivity reactions occurs. Flu-like symptoms such as fever, body ache, sore throat, etc. A painful red or purple rash that spreads. Blisters that could cause the skin to break down and cause open sores. Liver damage also occurs. Increased liver enzymes can be estimated on blood test. Pain in the abdomen, yellowing of the skin and eyes, tiredness. Drug interactions. When amoxicillin is combined with certain drugs, it may cause some reactions. We discuss in this following video. Drugs that increase the risk of side effects of amoxicillin are, these are the drugs which increase the side effects of amoxicillin. For example, probenecid. Taking probenecid with amoxicillin may lead to increased blood levels of amoxicillin. There is a need to decrease the dose of amoxicillin in these patients. Allopurinol. Using these drugs together may develop a rash. Interactions that increase the risk of side effects of other drugs. Taking amoxicillin with certain medications raises the risk of side effects. For example, taking amoxicillin with anticoagulants like warfarin, heparin may increases the risk of bleeding. In such cases, close monitoring is required. Interactions that make drug less effective. These drugs make the amoxicillin less effective. Drugs that are involved in making the amoxicillin less effective are chlorophenicol, macrolides, sulfonamides, tetracyclines. It is contraindicated in serious hypersensitivity to amoxicillin, diarrhea from an infection with Clostridium difficile bacteria, mononucleosis, chronic kidney disease stage 4, kidney disease stage 5, kidney disease with likely reduction in kidney function. Amoxicillin and clavulanic acid is a good combination. Clavulanic acid is a beta lactamase inhibitor. They do not possess any antimicrobial action. They bind to the catalytic site of susceptible beta lactamases to prevent hydrolysis of penicillin. Some of the bacteria produces beta lactamases, which makes the amoxicillin susceptible to the bacteria. In order to avoid this, clavulanic acid with amoxicillin extend the antimicrobial property of amoxicillin against beta lactamase producing bacteria. Beta lactamase producing bacteria are Streptococcus pneumonia, H. influenza, Klebsiella, methicillin sensitive Staphylococcus aureus. Doses are amoxicillin 250 mg, clavulanic acid 125 mg is available. Amoxicillin 500 mg and clavulanic acid 125 mg is available. These are generally preferred 2 times a day or 3 times a day.